Yeah.
Yeah.
Wow. We wait for other people to join.
Sounds
Yep.
good.
Great. You go for it, Annie.
Sorry, can you hear me okay?
Yep.
Okay.好，大家好，欢迎来到2021年兽医进阶培训系列网课。行动亚洲和兽医关怀无国界，非常高兴能够为您带来我们的系列培训网课。我们通过兽医的教育提升动物的福利。那今天呢，是我们今年的第8场网课啊，我们也是世界小动物兽医协会的教育合作伙伴。那今天呢，我是大家的主持人还有翻译我是 Annie。今天与我们一同连线的呢，还有来自兽医关怀无国界的外科专家Dr. Rebecca Wade。Rebecca, would you like to say a few words?
Yeah, sure. I wanted to firstly thank Elena Saltis for coming to speak to us today about physiotherapy in the vet clinic. Thank you so much, Elena, for all your time preparing and coming this evening. Would you like to translate, Annie?
那非常感谢，就是我们的艾琳娜医生，能够抽出时间，能够来到我们今天的这个线上来跟大家一起来分享关于网课的关于理疗的这些内容。
And secondly, just to say what a huge difference I think physio can make to patients under your care. I didn't have access to it for the first half of my career. And Elena opened the first veterinary physiotherapy clinic that was nearby where I was working back in 2009. Was it, Elena? 2011.
Yeah.
Yeah.
9.
There you go. Thanks, Annie.
那就是在 Rebecca 医生他这个行医的前半段的这个生涯过程当中呢，并没有任何的没有任何的渠道可以接受到关于这个物理治疗的这样的一些这样的一个内容。那这个 Elena 医生呢，他在2009年在新西兰开了第一家这个就是犬的关于犬的这样复健的这样的一个理疗复健的这样的一个机构，所以的话就是这就为Rebecca 医生带来了一个非常全新的一种各样的视野让他的这个工作然后各个方面都有一个非常全新的一个体会。
And so once I was able to make use of physiotherapy for my patients, both post-operatively and also chronic pain patients with injuries, arthritis, that sort of thing, I just noticed such a massive difference in both the speed and the quality of their recovery.
那就是在Rebecca 医生接触到这个理疗的这样的一个渠道以后，那他就是在自己的病患里面开始使用到理疗的这样的一个过程，然后他就发现，在所有的他的这些病患当中，不管是术后的，或者说是这些慢性疼痛的这些犬只当中受伤的这些犬只，或者是有骨关节炎的各样的一些情况下所有的这些病患呢，他们在使用了这个物理治疗以后，都有一个非常显著的一个恢复。
So I'm really hopeful that this information that you're going to get today is going to start off that journey for you in your practice and realize how much this can offer to your patients. That's really exciting.
那就是希望我们今天分享的这个网课里面所有这些信息，能够帮助到每一位参与的兽医的工作人员，在自己的这个诊所当中、诊室当中，也可以开始应用到物理的治疗这是一个非常令人激动人心的一个事情也让我们的病患可以有很多的一个受益。
So again, thank you so much to Elena, and I'll hand over to you to take over from here.
那就是再一次的非常感谢我们的这个 Rebecca 医生，感谢我们的 Elena 医生能够参与到我们的线上。So I'll introduce Dr. Elena for a little bit. 那我接下来呢，就是稍微的介绍一下这个 Elena 医生，她在美国获得了他这个物理治疗的学位，他在美国和新西兰也担任这个理疗师，有非常多年的这样的一个从业的经验。然后呢，他是专业的认证的犬的理疗师，在新西兰动物和兽医物理治疗协会，担任秘书。他在全世界为各个地方的这个兽医都开展了这个兽医的康复的课程，分享他的知识，分享他的技能，也让很多这个地方的这些病患都有非常多的这个受益。那所以我们现在也就不再多占用大家的时间，那我们一起来欢迎Elena 医生来分享她今天的这个理疗的课程。So without further ado, let's welcome Dr. Elena to for today's webinar.
All right, thank you, Annie. So today I'm just going to give you a brief overview on some physiotherapy rehabilitation techniques and concepts that you can implement into your veterinary practice.
好，那我们今天就是会 Yes， 那我们今天呢就会在这个网课的过程当中来跟大家分享一下我们在这个诊所当中，在我们平常的临床治疗当中可以经常常用的，也可以非常就是能够很快上手的这样物理治疗的这些手段和手法。
So just a quote from Taylor and Edmondson that rehabilitation can allow the acceleration of recovery time of some patients, and it can make either the best or worst surgical procedure better. And I love this quote because I do find this to be true, that we often find patients that access rehabilitation because their surgery or their injury or their condition is quite severe, and the veterinarians feel that they're at a kind of at an end point and they don't know what else to do, and then they refer them to us, and then we can make a significant difference in some of the principles that we implement.
好，那首先我先来就是带大家来一起看一下这样的一个句子：复健能够缩短某些病患复原的时间，并且能够增进最棒的或者是最糟糕的手术的治疗的效果。这个是就是 Taylor 和 Anderson 他在2002年做出的这样的一个说法。那就是Elena 医生也非常的赞同，因为就是在很多的这个情况下，很多的一些兽医师他们发现自己并没有能够帮助到，并没有能够真的是在这个临床工作中没有一个很好的一个手段可以能够进一步的来帮助自己的病患。那这个时候他们经常就会把这个病例呢转回到这个外科医生这里，然后希望他们能够有这个有一些这个可以帮助病患的一些手段。
And not all surgical intervention will progress at the same rate, as well as any other condition as well. So with post-op rehab, it's important that your rehabilitation program is specific to the surgery or the condition and also the animal's rate of healing. And you want to be continually evaluating and assessing your patient along the way to see when it's appropriate to progress at the various different stages and phases of rehab.
那就是所有的这个病患呢，他们不是说都是以这个相同的这样的速度来进行恢复的。那我们在这个不同的手术，然后我这个手术的这个操作，也不是说每一个病患他都是能够恢复到一个同样的一个程度。那所有的这个病患，他不论他们是做什么样的手术，还是以什么样的一个康复的这样的一个阶段其实都是应该不断的持续的去进行评估来看我们这个病患到底处于一个什么样的一个阶段。然后来确定下一步的这个操作的计划。
So first, I'm going to go through some post-op management intervention that we can do, and what our main focus is to achieve the best possible function and outcomes for the surgery.
那首先我们先从这个术后管理这个部分来入手，来看一下这个理疗是怎么样运用在术后管理当中。那当然我们是希望就是在这个病患他能够恢复到一个最佳的一个功能也能够得到一个最好的手术的结果。
So the first thing you want to do is develop a treatment plan. And with a treatment plan, it's important that it's first realistic, and it needs to be gradual with an end goal in mind. So I like to start with the end goal. So maybe it's like returning to agility and then starting your progressions backwards and then starting from there. And you want to develop this with the owner. It needs to be safe, but still effective and challenging. And you need to be continually monitoring, adapting, and evaluating the patient along the way. And your plan should be based on good clinical reasoning, based on physiology and evidence-based research.
We lost Annie.
I know. I'm here, no problem. What happened to Annie?
I'm still here.
Oh, good.
Yeah, something wrong with my computer, but I'm using my phone.
Right, well done.
所以那个第一点我们需要讨论的呢，就是说我们要制定一个良好的一个治疗的计划。那这个治疗计划，首先第一步要实际一定要就是贴近这个动物本身，然后我们需要谨记它这个，也需要一步一步的来进行，然后需要与饲主一起来建立一个行动的计划需要安全，然后有效，然后并且要持续的进行监测。然后最后来通过这个动物的这个本身，然后再来进行下一步的这个确认。
And then you want to write up some post-op goals. And it's best to do a combination of short-term goals and long-term goals. So an example would be for a short-term goal, it could be to reduce swelling and pain and achieve full range of motion. And long-term goal could be returning to work or sport or running in the mountains for an hour.
那就是我们还要进行这个术后目标的这样一个制定。那可能就是术后目标的话，我们会有区分，首先是短期的这样的一个术后目标，或者是长期的术后目标。那短期的术后目标的话，一般来说就是说我们先解决这个动物的疼痛问题让它这个炎症能够得到消退然后呢就是说它这个运动能够恢复到一个正常的这样的一个范围然后它这个长期的这样的一个运动的话术后目标的话，就是说它能够参与到一些比较激烈的一些运动当中或者说比如说它能够去山上去跑1个小时等等这样的一个目标。
So one of the main things that physio rehab does is we address the biomechanics of the body. And it's not just about the biomechanics of the joint involved, although that is obviously the most important thing, but how it affects the rest of the body. So for instance, if you have a cruciate reconstruction, and that is actually going to alter the biomechanics of the entire limb, of the hip, the hock, the spine, SI joint. And also, while they're still de-weighting or having gait abnormalities, that's going to shift the biomechanics of the entire body. So with rehabilitation, we need to address all the biomechanics of the entire body, as that will then affect your surgery.
就是我们在谈到理疗的时候，我们首先需要考虑的是这个动物的这个生物力学。我们谈到这个生物力学的时候，不仅仅是说按它这个关节能够有多大的这样一个活动范围，或者是它能够有一个什么多少的运动度。那有些时候它其实是一个 更全方位的，有涉及到更多的不同层面有些时候，比如说我们需要考虑它的整个的这个脊柱是一个什么样的情况，它的这个髋关节，它的这个膝关节，它的整个这个关节，它的整个这些骨骼各个关节是一个什么样的一个状况它有没有在这个增加它的体重，或者是它有没有能够有一个正确的一个这样的一个步态，就是说它是一个比较全方位的要去评估。
So some of the pre and post-op management considerations. So I put this down as pre-op is because I like to try and get most of this completed and sorted out before surgery. So they're all set, and from the minute they come home from their surgery, everything's in place and managed well. So yeah, did you want to say?
OK，然后我们接下来就是我们需要考虑一下这个术前和术后管理的一些考虑。然后针对于老师他自己本身来说，他更情愿说在术前就把这些管理这些都考虑都给他包括到，然后这样的话我们在手术过后，在手术之后能够更好的去进行一个安排。
So it's important that the floors that aren't slippery. So you want to go through with the owner what kind of floors they have and to address that. And there's some special devices that you can use to help with the floors, such as toe grips and sticky paws, which I'll show later, as well as a proper harness, which we'll go into later. And also what's important is making sure they have a good orthopedic bed and they're in a warm and dry place, and their confinement is sorted out before going home, as well as how they're going to transport their dog, and also keeping them separate from other dogs or pets, and addressing how they're going to navigate the home environment.
那就是我们可能比如说要跟主人讨论一下这个家里面这个地板到底是一个什么样的一个地面尽量要选择这个不会滑的这样的一个地面，或者是增加一些这个防滑垫，比如说瑜伽垫。那有些时候呢，就是说有一些这个市场上可以卖的一些内容，可以帮助我们的这个宠物能够有一个更好的一个运动的这样的一个方式。那比如说有一些这个指甲套这个是防滑的指甲套或者说是这个宠物鞋套这个宠物鞋套它是有一点有粘性的，就它走路的时候呢不会让它就是哐的一下就滑倒，或者是呢有一些比较好的这个肩背带或者是其他的一些各种各样的肩背带我们这些其实就是都是可以跟主人去探讨的。那这些我们刚才提到的这些内容呢，我们之后课程也会给大家展示告诉大家到底是一个什么样的一个内容。
Then it's important to understand and how to balance immobilization versus mobilizing. So we want to sufficiently and safely mobilize the body, so we're challenging the different tissues, so we're enhancing strength, stability, recovery, and healing. But at the same time, we want to be immobilizing it if we need to, because it does have a protective effect on the short term, but it can have a negative effect on the physiological features of the joint.
好，那接下来我们就要考虑的是，我们在这个病患他手术以后，我们需不需要进行这个固定？就是我们不进行固定呢，有一个考虑，就是说可以让这个组织有一定的刺激，来促进它局部的这个恢复和愈合。但是我们进行固定的话，它也有一个很好的保护的作用。但是可能它在一定的程度上，对于这个关节的这个生理功能会有一定的限制，甚至说是可能会有一些有害。所以就是我们需要就是两者来取其一，看一下我们这个利弊。然后来进行计划和分析。
And it's important to understand the physiology of the joint, and also when you're moving from immobilization to mobilizing it, what that does. So for instance, if you're mobilizing a joint, it can have quite a significant detrimental impact on the articular cartilage. But what the articular cartilage hates even worse is rapid mobilization after a period of immobilization, because that can really produce like long-term permanent damage to the joint. So when we're going from immobilization to mobilization, we have to be very careful how we manage that.
那我们刚才有提到说它固定的时候对关节生理功能会有一些有害，那现在老师就解释了为什么。那我们在这个固定的时候，其实对于软骨这个影响是非常非常大的。那虽然说就是我们其实感觉好像是固定的关节和骨头，但是就是这个软骨呢，它非常不喜欢就是在一个本来是在一个不太动的一个状态，然后突然一下就开始开始运动。所以就是我们如果真的是要考虑固定的话，我们需要考虑说我们这个关节怎么样来能够一步一步的让它能够适应，让它能够从这个被固定的一个状态，然后慢慢的恢复到一个可以正常运动的这样一个状态。
So I'm now going to just have you look at an example of a walking program for a typical post-op patient.
好，那接下来我们就是来看一下一个很典型的这样一个术后的病患，我们怎么样来为他做一个制定这个康复的计划。
And the walking program is actually part of the rehabilitation, and it has to be gradual and monitored, progressive, but also constantly evaluating the patient and adjusting it as needed.
好，那就是这个散步的这样的一个计划的话，它其实呢就是需要就是一个不断的去评估，然后要去看这个病患怎么样来应对他的这样一个怎么样对这个散步计划有一个什么样的一个应答，然后我们再不断的来进行调节。
So the walking program is important that the owners follow it pretty carefully with your guidance, and that it is progressive and it's progressive, but it's monitored and individualized for every patient.
好，然后我们在讨论这个散步计划的时候，它其实是这个术后复健的一个常规的这样的一个组成部分。那这个散步计划的话，需要是一个渐进式的，然后是需要有人去监控的，而且就是它整个的这个怎么样去散步，然后用什么样的方式来散步，这个其实是需要来个别定制的。
And the walking program is also extremely important for the rehabilitation. It's not telling the patient that they're allowed to do these things. It's telling the patient that they need to do this walking, because some veterinarians will tell the owners, your dog is allowed to walk 10 minutes now, or your dog is allowed to walk this now, where that's not what the walking program is. The walking program is part of the strengthening and rehabilitation program, and it's a prescribed activity.
好，然后就是我们需要注意的是，这个散步计划的话，它其实是术后康复的一个重要的组成部分。就是我们需要了解，就是说这个不仅仅是说这个动物可以来散步，而是说这个动物在术后需要来散步。那有些兽医师他可能说，哎，对主人说，哎，现在狗狗可以每天走10分钟了，但是其实就是说我们需要在这个意识里面需要意识到，它不是说这个狗狗可以走10分钟，而是说它需要它其实是属于这个医嘱的这样的一部分，就说每天之前可能可以每天可以走5分钟，然后现在的话我们可以走到10分钟，就说它其实是一个狗狗需要，就是说它是从这个康复的这个角度来看，它是需要有这样的一个运动的状态。
So moving on to therapeutic exercises, just like the walking program, they need to be specific to the patient, monitored, gradual, and appropriate for the stage and condition in surgery. And the different physiological stages of healing need to be considered. Also, the veterinarian plus the owner needs to understand and look for signs of discomfort, pain, fatigue, and make sure that these are addressed if they arise, and keep a good look on the form or the posture and the control during the exercise.
好，那我们接下来的话就是要来讨论一下这个治疗性运动。那这个就是和刚才的这个3步计划一样，它是需要循序渐进的，而且是需要对每一个动物来进行密切的监控，然后来评估。就是说我们在监控和评估的时候，也需要考虑到病患他具体所处的不同的阶段，还有他的状况。然后呢，需要考量他复原的这样的一个这样的一个过程，它到底是动物可不可以承受得住，然后就说它整个过程中有没有这个不舒服的感觉啊、疼痛啊，或者是疲倦啊，或者是它这个运动的品质和形式怎么样，然后它动物整体它本身的形式和姿态这些都是需要来考虑到的。
So there's 4 basic phases of rehabilitation.
好，复健的话有4个基本的阶段。
Phase 1 is from day 1 till about week 3 or 4. And this is when the initial inflammatory stage of tissue healing is occurring all the way through to the end of the reparative stage.
好，那第一个阶段呢，是从这个术后第1天到这个第3周或者是第4周的这样的一个时间。那这个其实是组织开始愈合，然后到这个发炎的时期完全的修复这样的一个阶段。
Phase 2 starts to target the challenging and the healing tissues during the remodeling and maturation stages of healing. And that's typically about weeks 4 to 6.
好，那第2个阶段呢，它是在这个愈合的组织它的重塑，以及就是说给这个愈合的这个组织一些这个刺激啊，帮助它能够更好的恢复。那这个阶段一般是第4到第6周。
Phase 3 is the remodeling and strengthening phase, which is about weeks 7 to 9.
好，第3阶段呢是这个第7到第9周，那基本上是这个组织的重塑以及强化的这样的一个时期。
And phase 4 is when the advanced strengthening phase occurs, and it's after healing has been completed, and typically around week 10 plus.
好，第4阶段呢，一般是这个第10周或者是第10周以后，那这个时候是处于伤口已经愈合以后，然后需要这个进行强化这样的一个阶段。
So here's an example of a good exercise, and this is to strengthen abdominals, and it's called the tummy tickle. And what you do is you just tickle their tummy, their abdominals contract, and they arch their back. And this is a good exercise during phase 1.
好，那这个呢，就是我们展示一下第1阶段这个比较很好用的这样的一个训练。那这个怎么做呢？就是说我们去挠这个狗狗的肚皮，然后它就会觉得非常的痒，然后就会把这个自己的身体弓起来这个对于第1阶段的这个康复来说是一个很好的一个锻炼。
And this exercise is really good exercise for phase 1. And what we're doing is we're strengthening the oblique abdominal muscles, and it's also active range of motion for the spine, as spine side bending and rotation are occurring during this exercise.
好，那我们刚才看到的这个小视频里面的这个锻炼呢，也是第1阶段非常好的这样的一个康复训练。那这个训练的话，就是说我们可以让这个狗狗它整个的脊柱能够能够舒展屈曲，然后有一个这个整体的这样的一个锻炼。然后不仅是锻炼到脊柱，它这个腹壁的这些肌肉也能够得到强化。
And this is another good phase 1 exercise. I'm pinching his toes, so he's actively moving his leg to get away from that noxious stimulus. And now I'm moving him in a walking sequence.
好， 那接下来的这个锻炼的话，我们可以看到老师在掐它的这个脚尖，然后这个狗狗呢，它为了要就是不想让老师去掐它的这个脚趾，然后就使劲的把这个脚收回来。那我们可以看到，就是老师他是在这样一个走路的这样的一个频率下，然后去掐它的这样的一个脚，然后这样的话就是通过这样的一个不断的回收屈伸这样的一个锻炼，然后来锻炼它腿部肌肉。
And this exercise is a really good exercise as it's an isometric strengthening. So I'm pushing into his hip and the opposite shoulder and now just into his legs as he pushes against me. So this is not only doing an isometric contraction, but it's really good for stability.
那接下来的这个锻炼呢，对于它的这个稳定性，然后还有这个不对称性的这样一个锻炼，都是一个很好的刺激。那我们可以看到，就是这个是怎么做的呢？就是老师他会去分别的去推它的这个狗狗的这个身体然后这个狗狗呢，它就是在这个推动下，然后可能会去左右的去运动，然后就是来去对抗这个被推的这样的一个力量。
So the next one is Cavaletti Poles, and this is really good for phase 2.
好，接下来这些锻炼呢是这个使用锥形筒、锥形柱，那这些对于第二阶段是非常好的锻炼。
And this is really good for getting equalized weight bearing, improving any gait defects such as like short striding or hip hiking or scuffing. This is particularly good for neuro patients that are scuffing, as it helps to improve the proprioception as they touch the pole, and also good for any dogs that have weak gluteal muscles or cranial tib muscles, as they have to contract these in order to manage themselves over the poles.
好，那接下来的我们说这个第二阶段，这个锻炼的话，它对于狗狗它增加它的平衡性，然后增加它的肌肉的这个强度都是很好的。那就是说，在这个很多这个病患他有这个神经学的一些问题的情况下，然后他可能就是肌肉后面的这些后面从这个后肢背部等等这些地方的肌肉，它可能会有一些问题，然后它有些时候可能，比如说，它没有办法有个很好的一个反射，然后导致它这个腿会有一些拖拉等等这样的一些情况，或者说它这个步态就看起来会有一些这个跳的会有一些跑着会跳一下，然后等等这些情况下，就是这样的一个运动对它来说都是一个比较都是很好的一个帮助。
And the red band that's tied around her waist is to it's to activate her abdominal and core muscles to gain stability and assist in this exercise.
好，那我们可以看到这个狗狗它这个系了一个红腰带，那这个腰带的话，它其实是帮助狗狗它这个核心就腹部的这些肌肉核心区域的这些肌肉能够有一些更强健的一些力量，帮助它能够恢复这个核心肌肉的力量。
In this next exercise, So this is for balance and proprioception, as well as strength and stability.
好，那我们看另外的这个锻炼，这个锻炼的话，它是帮助它平衡身体，然后呢也是能够强化它的这个肌肉的强度。
And I'm tickling her tummy in order to activate her abdominal muscles and core stability to improve the performance of this exercise.
好，那我们就是可以看到老师在让他锻炼的时候呢，同时也在挠他的肚皮。那其实这样也是就是帮助他能够把这个核心的这些肌肉群能够得到锻炼，来帮助他就是整体的这样的一个有一个更好的一个肌肉的强度。
In this exercise, I'm using the TheraBand to pull against the body, and she will contract the different muscles as I move around the leg.
好，那接下来这个锻炼，我们可以看到，刚才首先是拿那个红腰带去拉这个狗狗的这个不同的腿，然后就是在老师拉它腿的时候呢，也去抬它不同的其他的腿，那其实就是为的是要就是锻炼它这个不同的肌肉就是说虽然说可能有这条腿要抬起来，那条腿要抬起来，但是要去保持平衡，也就是通过这样的锻炼，然后强壮它的肌肉。
And I'm also just showed you some progressions on this exercise by lifting the legs and also creating disturbances in her balance to make it challenging.
那我们也可以看到，在后期的时候，除了把这个用这个绳子去拉它的腿，后来呢也去就说我们去抬起它的腿，到了后期我们还去用这个手去推这个狗狗其实就是说不断的增加这个锻炼的难度让这个狗狗在这个锻炼的过程当中能够有更多的这个肌肉得到锻炼。
And now this is an obstacle course.
好，那这个呢是这个叫做障碍课程。
And so this is combining balance, proprioception, stability, and strengthening.
那就是我们可以看到它中间加了很多的这些障碍物，那其实就是说同时也是在增强这个动物的平衡力，然后也在增强它不同的肌肉的这个强壮的程度。
This is a very advanced obstacle course.
那这个是比较属于比较进阶的、比较高级阶段的这样的一个这个平衡的这样一个康复的疗程。
Oops. And this exercise is specifically targeting the multifidus muscle, which is one of the main spinal stability muscles.
好，那我们现在看到的这个视频的话，那其实就是更加去强健这个动物它的这个重心点其实也是这个核心区域的这些肌肉群的这个肌肉强度。
So what I'm doing is I'm trying to get her into a plank position, and then I was adding rotation.
好，那我们可以看到这个具体操作的话，其实就是说让这个狗狗尽量去达到或者是实现我们平时做这个平板支撑的这样的一个动作。同时的话也是增加一些这个不平衡让这个狗狗去尽量的去保持平衡。
And these are more core stability and spinal strengthening exercises, where we're doing cross leg lifts on different balance equipment.
好，那我们也可以看到，就是说我们把这个狗狗它不同的脚来抬起来，那其实也是就是也在不同的程度上来增加它的这个核心肌肉的这个强度帮助它能够得到锻炼。
And with this exercise, by moving the ball forward, it really activates her core stability.
那我们可以看到，我们把这个前面的这个柱形的这个球体往前面推的时候呢，可以帮助这个狗狗就是它核心肌肉能够更多的得到一些锻炼。
And this one is just a really difficult stability exercise as well.
那这一个锻炼其实也是一个很难的一个这个维持平衡的这个锻炼。
And now we're moving on to a very advanced stabilization and strengthening exercise.
好，那接下来现在做的这个呢，也是一个非常难的 对于狗狗要求很高的这样的一个保持平衡和这个复健的这样的一个运动。
I don't know what's going on here. Hang on.
好，那我们接下来看其他的内容。
And here's another exercise with the front limbs up on a balance foam. So we're challenging weight bearing and also improving strength and stability.
好，那我们可以看到这一个锻炼的话，我们是让这个前肢站在一个这个泡沫垫上，然后就是去挑战这个狗狗它的这个平衡感以及它的这个稳定性让它能够得到锻炼。
And then I was doing single leg lifts, and now I'm doing nose to hip, which is really good for weight bearing and range of motion of the spine.
好，那我们可以看到，刚才一开始老师先是把他腿给抬起来让他得到锻炼，然后现在呢，就是让他把这个把这个嘴巴，然后让他尽量的去触碰他后面，通过这个零食其实对于他的这个脊柱，然后对于他的整个这个运动性都是得到很好锻炼。
And just showing you that TheraBand exercise again and how it affects the different muscles and watching them contract.
好，那接下来我们又是用这个红丝带，然后来让这个狗狗不同的肌肉群，然后通过不同力量的不同方向的这个使力，来看到它这个不同的这个肌肉群的收缩可以看到很多的这个肌肉得到锻炼。
And this is sit to stands, which is basically moving squats. So it's really good for strengthening of the quadricep muscles, the glute muscles, and the hamstrings.
好，那我们可以看到这个左边的这个锻炼呢，就是说让这个狗狗蹲一会儿又站一会儿，蹲一会儿又站一会儿，其实就是相当于是让它这个蹲着坐一会儿又站一会儿，坐一会儿转一会儿，其实让它这个蹲着走。那这样的一个锻炼，对于它的这个股四头肌，还有它的这个臀部的这些肌肉都是非常好的锻炼。
And backwards walking, this is really good for strengthening the hamstrings and the glutes.
好，然后这个呢是这个倒退走的这样的一个锻炼，这对于它这个后肢肌肉群也是非常好的锻炼。
I don't know why my slides are doing this.
好，那我们接下来
And
看
then doing weave pulls through the cones is really good for weight bearing of the inside limb, plus range of motion, and also it's helping to improve the biomechanics.
好，那我们可以看到，就是接下来呢是引导这个狗狗通过这个 S 型蛇形的去绕着这个锥形柱去锻炼。那这样的一个锻炼呢，对于这个狗狗它的肌肉的这个活动性得到增强，以及说它肌肉四肢内侧的肌肉还有它整个生物动力学都有很好的帮助。
And just going through the Cavaletti Poles again.
好，那我们接下来这个是另外一个形式的这样的一个锥形柱加上中间的这个横挡。
And some advanced strengthening.
这个是一个比较进阶强化的一些训练。
And we're using different types of balance equipment to challenge the patient.
那我们有结合使用不同的这个平衡的这些器材，来让这个狗狗得到这个充足的挑战。
And you can see the muscles really contracted, not just his rear limb, but look at his abdominal muscles and his front limb and his rear limb muscles really working.
那我们可以看到，这狗狗站在这些器材上面的时候，它整个的肌肉都是非常的紧张就是说它的不仅是后肢肌肉、前肢肌肉，还有它这个脚部的肌肉，这些所有的肌肉群都有得到很好的锻炼。
And this is an example of how you would progress exercises. So I would be progressing these probably 1 week apart.
好，那以上就是一些演示，我们怎么样来通过不同的这个肌肉的这个锻炼的形式来增强这个肌肉的强度。那老师他可能会比如说差不多1周的时间来作为间隔。
And then we can combine some obstacle courses with the Cavaletti Poles and balance equipment.
好，那这个就是障碍训练，然后还有这个锥形柱一起结合。
Not sure why my slides keep doing this.
好像老师那边他的这个幻灯片会。
So now I'm going to just introduce a couple basic manual therapy techniques.
好，接下来呢，我们要来讨论一下这个徒手治疗，就说这个我们手动用人的这个人工来帮助他来运动的这样的一些技能。
So passive range of motion. Passive range of motion is really important, and I like to start this before surgery and instruct the owner to start doing it the day after surgery. And this is really good to help stimulate the synovial fluid, which will bring nutrients into the joint and waste products out of the joint. And it's also good to decrease swelling and improve the joint proprioception, as well as reduce pain.
那首先我们需要讨论的是这个被动运动。那被动运动，老师非常喜欢这样的一个治疗的方法。也就是说，他在术前的时候就会介绍主人，然后来进行这样的一个运动。然后术后第1天也会开始，就是慢慢的来进行这个被动运动。那这个就是运动它有什么用呢？它可以帮助我们这个关节液的生成，然后就是营养它这个关节的局部，同时也把关节内部的一些毒素也能够通过因为这个更多的这些循环能够被排出去，然后呢也因为这样的一个有这样的一个生理学的这样的一个机制导致它疼痛能够得到很好的控制，它也能够很好的消肿就它炎性也不会有那么多的炎性反应。
Also, achieving really good passive range motion is one of the key components of biomechanics. So this is very important.
好，那被动运动就是它能够也能够让它最后也能够帮助动物恢复到主动运动。
And passive range of motion should always be gentle and rhythmic and pain-free.
那所有的被动运动，它都是应该非常轻柔的来进行操作对于动物来说，应该是没有疼痛的。然后呢，就是也能够是有一个有这样的一个有规律的这样的一个运动。
So this is passive range of motion in the rear limb. So I'm going to be going through first the digits. So I'm flexing and extending them.
好，那我们就可以看这个被动运动怎么样来进行操作我们在这个四肢上进行被动运动的话，那先从这个远端的肢体，先把这个指关节让它屈，然后给它伸直，然后接下来呢，逐渐的往上。
And here, like if it's a post-op cruciate, like I might start with just really gentle passive range of motion, and then over the next few weeks, regain it to full range of motion. And now I'm doing the hip.
好，那假设说这个动物它有做这个膝关节的手术，那这个时候可能会，就说首先先是非常非常轻柔的来一点一点的让它被动的有一些运动，然后最后再逐渐的增加它的运动的强度和它的幅度直到它能够达到一个完全的一个运动的幅度。
So weird. So therapeutic massage, there's a lot of different forms of massage. But in this presentation, going through all the different massage techniques is beyond tonight. So just to let you know, a flouage is done to try and decrease swelling and help pain and sensitivity. Deep tissue mobilization is when we're trying to actually mobilize the structures to release them, especially if they're tight. Transverse friction massage is friction that's applied at a perpendicular angle to a structure. For instance, we'd like to do transverse friction to the patellar tendon after TPLO or TTA or TTO, as the patellar tendon is at a different angle than it should be physiologically. So we want to work on that. Trigger point release is when we have an actual active trigger point, which is a really tight area into a muscle, and release that. And myofascial release is when we're actually working on the fascia to release it.
那接下来我们谈论一下关于按摩。那治疗性的按摩其实它有非常非常多不同的一些类型。那就是我们今天要完全的覆盖说哪一个按摩要怎么具体操作，那今天是不太可能的。那我们只是大概提一下以下的不同的这些手法。那首先这个俯推的话，可能就是说让这个局部的这个肌肉，局部
Yeah, but those are really difficult to do. So this next technique is an excellent technique to either do yourself or to teach your owner. And I'm using a spiky ball to do the massage, and it looks quite gentle, but it can be quite, it could be as hard as you like, but it's also extremely effective and very well tolerated by dogs.
好，那我们刚才有说有很多的不同这些按摩的手法，那有很多的一些手法是针对不同的这样的一个具体的一些内容。有些时候是想要把这个深层的组织让它松动，或者说让它这个膝关节的术后想要某一些角度来帮助这个组织的恢复，或者说它有一些痛点要把它松弛开，或者是筋膜要来作用。那接下来我们可以看，就是说这个时候有些时候可以用这个按摩球，它上面有一些尖尖的。那有些时候感觉好像说这个狗狗不太耐受，其实就是说绝大多数的动物它都非常享受这样的过程。
And here I'm actually working on the quadratus lumborum, which is tight in a lot of dogs. And now I'm going into the iliopsoas and the adductors.
好，那我们可以看到，刚才老师在他这个侧腹部的这个点，就很多的狗狗在那个地方，它都非常的紧张。然后接下来有作用到它的这个大腿的内部，这些就是帮助动物来放松。
And just working down the leg onto the different muscles.
好，然后接下来就是腿的不同的部分帮助它们来放松。
Don't know why this is happening. So joint compressions are an excellent manual therapy to do immediately post-op, as they're really good for pain reduction. It stimulates that synovial fluid. It helps to decrease swelling. It will stimulate that joint proprioception and sensory awareness. And it should be gentle, rhythmic, and pain-free.
那关节挤压是一个非常好的这样的一个术后就可以采取的复健的这样的一个内容。那它对于关节的疼痛的减轻、刺激关节液的分泌、减少水肿帮助动物这个感受器本体感受和感觉意识的恢复，都很有帮助。它也同样是应该是很温和的、有节奏的让动物没有疼痛。
So here I'm going to be doing joint compressions with the hock and the stifle.
好，那我们可以看到，这个是针对于腹关节和这个膝关节的关节挤压。
So it's very gentle and rhythmic and comfortable for the patient.
那我们可以看到，这个是很温柔的、轻柔的，然后对于很有节奏的，对于动物来说也是很舒服的这样的一个状态。
And this is one of my favorite things to do for post-op orthopedic patient.
那对于这个骨关节手术术后的动物，老师非常喜欢做这个锻炼。
So ice. So you want to apply this during the first 72 hours, and this is going to help the blood vessels produce vasoconstriction. So it's going to decrease swelling and reduces inflammation. It's really good for pain and muscle spasms and decreases the nerve conduction velocity, which leads to the decreased pain.
好，那我们来讨论一下关于冰敷。那这个是应该术后头72小时，或者说受伤以后72小时就应该来操作的，然后可以有助于血管的收缩，减轻减轻动物的疼痛，还或者是肌肉的痉挛，也降低神经的传导的这些速度。
And then heat starts after that 72 hours or when the edema is completely resolved. And what the heat does is it increases the blood flow by producing vasodilation, which helps to decrease pain. It increases joint and the tissue and muscle flexibility, assists in healing, and promotes relaxation.
能不能谈论一下这个热敷？那这个热敷应该是72小时，或者是水肿消退以后，然后才可以来使用。这是为了帮助血管的扩张，增加它的血流，也可以减少它疼痛，增加组织关节的柔软度，是有助于动物复原，促进动物的放松。
If swelling is still apparent or persisting after 72 hours, then you don't want to go to straight heat. You want to do what's called a contrast. So you do ice, heat, 5 minutes each. So it'll be a total of a 20-minute treatment. And I like to do it at least 3 times a day, but you can do it once an hour if you like. And it'll most likely just eradicate swelling and be completely gone within 1 to 2 days.
那如果就说这个术后或者说伤后，它72个小时了，它那个局部还在肿胀，那这个时候呢，就是我们来交替的冰敷、热敷、冰敷、热敷，每一次冰敷或者是每一次热敷都是5分钟。然后老师也就是说我们冰敷、热敷、冰敷、热敷，每次5分钟的话是这样一个循环是20分钟。那老师他是喜欢至少3次。每天来做3次，直到它完全消肿。那如果大家有时间的话，每个小时也可以帮它来敷1次，然后这样的话就可以真的是很快的让这个局部完全的消肿。
And some bracing. So I absolutely love the Therapeutic braces. They can be custom made, or you can buy them just stock off the shelf. And they're excellent because they can be removed. So you can then apply your heat, do your dressing changes, do some exercises out of the brace if you like. check your skin, and you can also customize the degree of immobilization that you'd like, and you can change it along the way of the rehabilitation journey. And then you can even turn a immobilized brace into a sports brace.
好，那我们来讨论一下这个护具。那这里有个网站，老师非常喜欢从这个地方来买，不是为他们打广告啊，只是老师非常个人喜欢啊。那这个护具的话，它很好，就是说它能够个人的去定制，或者是呢就是说它有成品化的去直接买也没有关系。然后这个东西它可以随时来移除啊，可以来冰敷或者是热敷来换敷料啊，来帮动物来进行这些各样的运动。检查它的皮肤，或者是来改变它这个固定的这些程度，然后就是它一些定制的一些护具，最后还可以变成这个运动的这个护具，所以就是老师他个人非常喜欢。
And here's a few of their braces. So that's a sports brace to the left. Up to the top right is a brace that I've made a thermoplastic insert that you can later take off. And then in the bottom picture is an air splint that you can actually even either just blow it up with air to stabilize the limb, or you can even fill it up with water, cold ice water, or hot water.
好，我们可以看一下接下来这些护具。左边的这个护具的话，它是一个运动的这样的一个护具，增加它的这个稳定度。那右边这个护具的话，它里面加了一些这个，加了一些这个防护隔热的这样的一些内容。然后下面这个的话，就是你可以它是中空的，所以呢，你可以直接把它冲入空气，用空气来进行这个固定，或者呢，你可以在这个护具里面灌热水或者是灌冷水，根据你的需要。来把它做成这个冷敷或者热敷。
And on a note, I like to put a brace on every amputee, especially a four-limb amputee, because what happens is after the amputation, that front limb, especially that carpus, has an unbelievable amount of forces that go through it. And in my experience, I found that without it being braced, that it will then eventually start collapsing and causing all kinds of problems. So I get all my amputees into this brace, but they only have to wear it when they're out for walks. They don't have to wear it all the time.
好，那接下来就是说在这个就是说我们做这个截肢的这样的一个动物，特别是就是它整个肢体都被截掉的这样的一个动物，特别是前肢，它这个前肢是需要带一个护具的，因为就是它在这个腕关节这个部分有很大的一些压力，有些时候就是没有一定的保护，它后期会有很多的一些问题，所以就是这个动物它不需要一直都带着，就是你出去去散步的时候需要帮助它有这样的一个稳定，但是就是它在室内或者是其他的时候休息的时候就可以给它拿掉。
And here's examples of some good fitting harness. These are the rough wear range. The top one is just your regular street wear, and the bottom one is for neurological dogs or really large dogs.
好，那我们也需要给动物挑选一个合适的这个胸背带。那我们可以看到上面这个就是比较常见的，我们经常看到的很普通的这样的一个胸背带。那右下角的这个的话，就是它是处于这个神经有一些问题病变的这样的一个犬只，或者呢就是说很大的一些大型犬，它们需要用这样的一个胸背。
And here's some devices for paw stability. So on the left is some little paws, and they have little sticky things on the bases of them to grip to the floor. And on the bottom, there's the toe grips, which is the Dr. Busby's toe grips, which you can put on there, and they can last for a few months if you add a little bit of super glue.
那我们可以看一下这个怎么样让它这个爪子有稳定性，增强它稳定性。左边这个的话，它这个小鞋子它的下面它有一些这个黏黏的这个部分那狗狗在走路的时候就不容易滑倒。那右边下方的话，就是它在这个爪子上也可以给它套一些这个指甲套， 那这个指甲套你如果给它稍微粘上去的话，那可以在这个上面待个几个月都没有问题。
Now, this patient has what's called a help him up harness, which is amazing. He's had an FCE and lost the function in his left rear limb. So then we've attached a little booty as well as some TheraBand to help advance the limb.
好，那我们可以看到这个胸背带的话，它有一些这个辅具非常神奇。就是这个狗狗它其实因为病理的状况，它左边这个左后肢是没有办法来移动的。那就是老师他们就利用一些胸背带，然后增加了一些就是一些各种的一些一些设备，然后就帮助这个狗狗可以抬腿，可以来正常的走路。
And without this contraption and the brace and the harness, he wouldn't be able to walk.
那就是说，如果没有这个，帮助它收缩，帮助它这个，站起来的这样的一个辅具，它没有办法走路。
And this is another example of that help him up harness. And this patient had an FCE and he hadn't walked for 10 days. And this is his very first steps.
好，那我们也可以看到，这个是另外的一个病患。那刚才那个动物它是一只腿走不了，那这个动物它有10天的时间都没有办法，也是因为就是生病。那我们可以看到这个胸背带就帮助他。那这个我们录像的时候是他10天以后第一次来迈出第一步这样的一个状况。
And now just talking about some limited mobility care. So when patients are on cage rest or strict restrictions.
好，那接下来呢，我们讨论一下关于这个我们关照动物的时候，照顾它的时候要限制它的运动。
So there's a difference between cage rest and active rest. So a patient can be put on cage rest because you're trying to immobilize them and keep them quiet and help them heal. But during that time, you can also have intervals of active rehabilitation during that time that can really benefit their recovery.
好，那我们来讨论一下这个笼养还有这个主动休息。那这两个概念其实是有一定区别的。那我们笼养的时候呢，可以把这个动物让它就是通过在笼子里面待着，限制它的运动。但是呢，就是我们也可以就是不定期的把这个动物给它放出来让它能够有一定的运动。
So during this time of limited mobility, you want to have a turning schedule that you give to the owners. So they're turning, I like to have them at least every 2 hours or more, having a toilet schedule that they keep to, looking at the bedding, making sure they have a good orthopedic bed and the cage is big enough for them to stand up, turn around, get water. And you can also apply manual therapy and some cage rest exercises.
好，那我们在这个限制运动的时候，我们需要给主人一个很好的就是一个时间表。那我们需要帮助这个动物来安排它翻身的时间，安排它什么时候上厕所，然后要看它的这个垫料是怎么样的，它的笼子也需要足够的大。那有些时候可以就是让我们人在里面去进行徒手的这些治疗甚至是在这个笼内进行一些运动。
I also prescribe at least 30 minutes in nature during their cage rest, as research has proven that this can help increase healing rates and recovery.
好，那就是老师除了刚才跟主人交代以外呢，他也会就是医嘱中特别强调，就说我们每天需要让动物30分钟在这个阳光之下，能够在这个大自然中来让他们有这样一个 时间。就是研究是表明，就是说每天30分钟，至少在户外的这样的时间，能够促进动物的复原。
And I'm not going to go through all of this, but you'll have access to this afterwards. But these are the different things that you can do with a cage rest patient. Most, not most, but a lot of veterinarians will prescribe cage rest, and that's it for the patient. And when there's so many things that we can do with them during that time.
好，那我们需要考虑的是说，这里这个表的话，就是我们没有时间来完全的一一来列出，但是大家也不要担心，我们之后这个课间是要进行分享，所以大家也可以去看。那就是我们很多的时候跟主人说，好了，我们这个动物需要笼养，然后就把这个动物关在笼子里面。但是就是我们需要意识到，即使是说动物在笼养，它在这个复健，那其实是有很多的这个事情是可以来做的，来帮助这个动物很好的恢复。
And treatment of osteoarthritis. So there's a lot of components in the treatment of osteoarthritis. And what we want to be doing is first doing pain management, working with the surgeon or the doctor or the veterinarian to get a good multimodal pain management on board, so their medication is sorted. But also we can be using different modalities, different exercises to help with motion of the joint, stability, and specific osteoarthritis exercises. We can do manual therapy, so range of motion, massage, joint mobilizations, flexibility exercises and stretching and joint compressions. We want to be implementing a walk activity program that's progressive and monitored and gradual. And of course, do some heat, cold therapy, and work with the owner on the different restrictions that could flare up osteoarthritis. If they're overweight, we want to be working on weight management and addressing the home environment to make sure that it's safe and appropriate for the patient.
好，那我们接下来谈论一下关于治疗骨关节炎呢。治疗骨关节炎的时候呢，其实它有很多不同的这个成分可以被包含在其中。那首先我们是要讨论这个动物的疼痛管理怎么样，也就是说我们这个术后这位兽医师，然后手术的医生，然后包括理疗师或者是其他涉及到的人员，需要用这个多模式的镇痛的一个方式来运用在动物的身上，让这个动物的这个疼痛得到很好的管理。那接下来就有很多不同的各种各样的治疗的方法来帮助动物来进行骨关节炎的这样的一个康复，或者是缓解它的症状。然后我们可以给它做这个治疗性的运动，刚才前面说的让它这个肌肉屈啊、伸展啊，或者做这些徒手的一些治疗，然后帮助它有一些按摩呀，或者是为它制定这个散步的这样的一个或者是活动的这样的一个计划和方案或者是用这个冷热的一些疗法。然后就是有些时候可能就是说它如果是骨关节炎是因为其他的一些原因来造成的，那我们需要考虑一些限制，然后去帮助他这个在家里面的这些环境有一些这个调整。如果是超重的话，也需要进行体重管理。
Quite often I have patients or owners and veterinarians tell me that their lameness is behavioral. And especially, I see this especially like in small dogs with post-op luxating patellas or cruciate, and they're not fully weight bearing or they're having some lameness issues, and they write it off as being behavioral.
有些时候呢，就是老师他在临床工作中，经常会碰到有一些主人也好，客户也好，会跟他说，他的这个跛行其实是一种行为问题。那更常见的是这个小型犬，比如说他做了这个髌骨或者是髌骨的一些这个内外托的手术，或者说做了一些这个膝关节的这个韧带的这些手术他有些时候会有一些跛行，然后就是没有办法站立他的后腿等等。那就是这些情况下，然后主任就会对老师说，哎，他是有个行为问题。
And I find that it's very rare for lameness to be behavioral, and there's normally a reason. So it's my job and to find out why that's happening and why they're continuing to be lame when they shouldn't be. So I've just listed some of the reasons. This isn't all the reasons, but some of the reasons that why lameness could be continuing. So they could have a decreased range of motion in the joint. Tight digital flexors, this is a big one. So if a patient has been non-weight bearing for a while, then their digital flexors tend to tighten up. And then when they do go to try and put weight on those, on the digits, it hurts. So they continue to be lame. They might have pain, swelling, which will limit the range of motion and function in the joint. They could have muscle weaknesses or muscle imbalances, tight muscles or tendons. Often the spine or the SI joint could be involved. Let's say they've had hip surgery or hock surgery or knee surgery and they've been de-weighting for a while. What that'll do is cause the spine to tighten up and also the SI joint. And also, like if you have a condition where there's an instability, such as a luxating patella or cruciate or hip dysplasia in a young dog, the body absolutely hates instability. So they'll always have other areas of the body that will tighten up to try and stabilize. And you'll see that happen in the spine and the SI joint in those rear limb dogs. Or there might be another joint that's involved somewhere that's causing the lameness. If you've had a cruciate patient, you might have decreased patella mobility or patella tendinopathy. So with the patella mobility, especially following cruciates, when you bend or flex the knee, the patella should be gliding inferiorly. And when you extend the knee, the patella should be gliding superiorly. And often after surgery, that patella mobility is affected. And that can then affect the mobility of the knee flexion and extension and cause lameness. And of course, there could be some surgical complications or infection or late meniscal tear or something like that. Or they might have developed some OA or degenerative joint disease in that joint.
好，那刚才老师有提到说，有些时候主人抱怨说这个可能是个行为问题，但是呢，因为行为问题而造成的这个持续性的跛行，其实是非常非常罕见的。那所以就是作为兽医师或者是作为这个专业人员，我们需要来找出来到底是因为什么让动物这个持续的进行跛行。那通常会有以下的一些原因当然所有这些原因不是所有的这个都列在这里，只是说很常见的一些原因。还有些时候是这个关节的活动能力它要下降，或者说它在这个指尖它的一些屈肌过紧。那因为就是说这个肌肉有一段时间没有进行运动，那它这个就是它末端的这些关节的肌肉就会紧张，就很紧绷。那它就是尝试开始去走路的时候就会觉得很疼，然后就不会去所以就不去落地，不去着地，或者是它有可能会有疼痛、有肿胀、虚弱或者是肌肉肌腱某些地方太紧了。或者是它在脊柱或者肩胛关节它有错位，就是说我们整个身体它对于关节的错位和不稳定它非常的排斥，所以肌肉为了要我们的身体为了要弥补这样的一个情况，它就会让这个其他的一些地方就会特别的紧张。那这些其他的一些紧张肌肉的这些肌腱的紧张也会导致它其他的一些疼痛，就是让它整体的这个身体就是会有一些问题。或者有些时候跛行是因为其他关节的一些问题。那有些时候比如说这个髌骨手术它这个做了手术以后，它这个髌骨它在膝关节它在屈曲和伸张的时候，它的这个髌骨是需要进行活动的，但是因为它某些原因它可能就是会有疼痛它那手术它就不愿意去动或者是手术它有并发症感染等等半月板的问题，或者它发展出来了骨关节炎或者是退化型的关节炎等等，那这些原因都会导致这个动物术后有持续的这个跛行。所以就说它是因为行为问题而造成的这个跛行是非常罕见的。 那我们需要真的是要去找一找到底是什么原因啊，帮助动物来解决这个问题。
And also just looking at some modalities. So I quite often use laser in the clinic, which is light amplification of stimulated emission of radiation.
好，那我们可以来看一下一些其他的辅助治疗的一些手法。那就是老师非常常用的是这个激光，它是把这个光来这个集中起来，然后打出来。
And laser is amazing. So it increases the ATP production, which is like the energy protein in the cell, which will then help stimulate cell metabolism and tissue regeneration. Also stimulates endorphin release, so it's really good for pain. So it's excellent for healing pain, inflammation, wound healing, and it's also good for treating infection or preventing infection.
好，那就是激光的话，它是非常神奇的一个内容。它会增加这个细胞内它这个 ATP 的产生，也会刺激它的新陈代谢，加速组织的再生，刺激内啡肽的释放，然后对于这个愈合、疼痛、炎症、伤口愈合都非常的有帮助。
And this is a patient that I saw in Spain, and really deep wound. The surgeon was pretty convinced that he was going to have to do quite an extensive surgery to heal this. And this is about 3 days after the wound, and it's on the picture on the right is about 3 days after, so you can see how it's already starting to granulate.
那就是这个病例，老师分享的话是他在这个西班牙见到的一个病例。那这个我们可以看到他这个伤痕非常的深。那就是当时这个兽医师就是觉得可能只有这种非常大范围的、很激进的这种手术才能够把这个给它修复上。那我们可以看到这个右边这个图的话是受伤以后3天，那我们可以看到周围已经开始有这个形成肉芽组织。
And this is the same wound about 4 weeks later.
好，那就是我们这张图片可以看到，就是1个月后、4周以后同一个地方，同一个地方的照片。
So he never needed surgery.
所以就是这个动物就没有做手术。
And then electric muscle stimulation. So we use this to activate muscles. So it recruits muscle fibers. So it's really good for dogs with extreme atrophy or neurological patients.
好，那接下来呢，这个是叫做肌肉电脉冲刺激的训练。那我们可以用这样的一个训练来刺激肌肉的一个生成。
And this is a patient in my clinic in Spain where I have a clinic in a rescue greyhound sanctuary.
那这个就是老师他在西班牙的一个诊所的一个病例。那这个是就是被救助的一个灰猎犬，一个灵缇。然后他来的时候，然后有这样的一个情况，然后老师就用他这个训练去治疗。
And this is the same patient.
那这个是同一个病患，我们可以看到这个前后这个对比真的是非常大。
And she's now living in California and living a beautiful life with a loving owner.
那他现在就是这个狗狗是住在加州，然后它的主人也非常爱它。
Right, that's me.
好，那以上就是今天分享的这个全部的内容谢谢大家聆听。
So, any questions?
大家有没有什么问题、疑问或者想要讨论的地方？I feel the last part, the electric muscle stimulation, looks a little bit like electronic acupuncture in China.
Oh, really?
Yes. 我刚才在跟老师说，我说感觉最后的这个肌肉电脉冲刺肌训练，感觉有点像我们中国的这个电针，就是针灸电针，对，有点这个类似。So in China, we use acupuncture a lot in human and
Yeah.
also animals as well. Yeah, and sometimes after they are on the acupuncture, and then people they put them on electronic stimulation as well, and then but not to gain muscles, more like helping them to gain neurology functions. So
Right.
yeah, they just look very very similar.
Yeah. I love acupuncture. And like, so you stimulate the needles with the electricity?
Yes, yes, and
Yeah,
yes, in some
I've seen
places.
that. That's excellent. I love that.
Yes.
It's really good for trigger point releasing as well.
Yeah. 好，那我们刚才我在跟老师讨论说，我们在国内也有很多就是针灸的时候也会用这个电针，然后把这个针灸，然后接上这些电刺激。然后老师说，这些对于电针对于它这个释放它的这个肌肉的疼痛也是很有帮助的。So we got two questions here. So one is, can we use these physical therapies after abdominal surgeries? So that's the first question.
Yes, definitely. Also, I was going to say that I have yeah, you definitely can use them after abdominal surgery, first of all, yes. And especially like those tummy tickles and the side bending, like the oblique exercises would be excellent for that. And I have a post-op exercise protocol that's quite detailed, and it goes through the different stages of rehabilitation. And I'm happy to send that to you, Annie, so you can pass that on.
Yeah. 好，那刚才第一个问题是说，腹部手术术后也可以做这些理疗吗？那老师说是，当然是可以的。那就是特别是像我们刚才最先提到的，去挠他的这个腹部，或者是让他就是把他的这个头，然后去往后去用食物去引导，然后让他回过头来等等这些，就说他这个这些运动对于这个腹部的恢复是非常好的，也非常有利。那老师他自己他有一个就是很好的针对不同手术不同阶段，他有一个有一些列表，然后他也非常愿意来分享，所以就是我们可以之后可以把这个文件也分享给大家可以看。Thank you so much.
Also,
That's wonderful.
Sorry, Annie, just to add there too, with your abdominal surgeries, ice is always going to be helpful on their tummy and heat later. It's quite sore having surgery on your tummy.
Yeah, and laser would be really good.
OK， 好，那接下来就是说Rebecca 老师在补充说，我们在这个腹部手术的时候可以用这个冰敷。就是进行冰敷，然后一段时间72个小时以后进行热敷，这个对于它的这个腹部的恢复也是非常有帮助的。那我们腹部手术以后其实很疼，那我们用冰敷等等都是可以帮助它减轻疼痛，也有恢复。Thank you. Yeah. So the next question is there an online course that the vets can carry on studying with you?
Not at this stage, no. Yeah.
Okay.
No, but there's actually a really good online training through fourlegrehab.com, and you can sign up for that, and it's excellent. And they have about 100 videos on all different aspects of rehab, and it's excellent. And it's with Lori Edge Hughes, which is one of the best animal physios in the world, really. She's amazing. She trained me. Yeah, so fourlegrehab.com, just an amazing resource.
Okay.
And it's all kinds of videos.
Yeah, fourlegrehab.com.
Yeah.
OK，好，第二个问题是说，问老师是否有线上的课程培训可以学习。那刚才老师他说他自己本人的话，暂时没有做这种线上的系列的培训课程，但是呢，就是说他有一个网站，大家可以从这个网站上可以看到这个叫 fourlegrehab.com，然后这个网站上它有各种各样不同的这些资料。大概有100多个不同的视频，有各种各样的这些康复训练的这些物理治疗所需要用到的各种各样的这些锻炼可以去那里去学习。那这个网站它的这个背后的这个人呢，他是我们今天请到的老师的老师，也就是说他是可能是世界上最好的这样的一个康复理疗师，所以就是大家如果感兴趣的话，可以去那里去搜寻一下资料。好，大家还有其他的问题吗？
I'm wondering how many people would have access to laser? Is it becoming popular in China?
Popular, I know a few have. 那我们接下来问一下其他的大家有没有自己诊室里面有没有激光？老师有点好奇，有多少人可以有激光？可以回答一下吗？Well, I know that Dr. Jiao has laser, and
Yeah.
few of our trainers, and Dr. Ying says
Yes.
here many hospitals do. Yeah.
Yep. Which is great. Probably more than in New Zealand.
Yeah.
Yeah.
OK，
Good.
好，
It's good.
那老师觉得我们国内有激光非常好。OK, someone says in the chat that they have Samyus laser. Is that a brand?
I'm not sure.
Maybe, yeah, or company.
And then there's quite a lot of differences in the quality as well, isn't there, Elena?
Yes,
Yeah.
quite a bit. And it's like almost everything in life, the more money you spend, the better quality. Because if you try to go for a cheap laser, a lot of the lasers aren't actually therapeutic. Like you're wasting your time. If you're using a cheap laser, it won't do much. Might help wrinkles or something, but it's not going to actually stimulate healing. So laser is one of the things where you do want to spend your money and make sure that you understand the parameters and yeah, the wavelength and everything. Yeah, you need to, if you're going to be buying a laser, you want to research it properly to make sure that you're spending your money on something that's actually going to be therapeutic.
所以刚才老师在说，就是这个激光的话，它其实对于它不同的厂家、不同的来源，它会有很多的这个不同的质量。也就是他们那边，他是感觉就是说需要做很好的这个调研，然后要了解我们这个激光的参数，然后才最后来下决定说要来投资，要不然可能钱也花了。然后就说感觉这个时间也花了，然后也来开了激光来为动物来做，但是呢达不到这个想要的这样的效果，那其实就是很浪费。所以就是老师就是说比较建议就是说要调研好，然后了解好。然后的话就说有的激光它可能只是说可以去除一下皱纹呐这样的有的激光可能才要达到某一些参数，它才能够就说促进这个肌肉的这个恢复。所以就是建议大家要多了解，然后再来去进行投资。So there's one more question. Can cats do therapies like these? Would it be difficult?
Yes, absolutely. And we see a lot of cats and they do great. Yeah.
然后就是这有个问题说，猫是否也可以做这些治疗，会不会更加困难？然后老师说当然是可以的，然后他们也有很多猫咪的病例。那猫咪的话，它也是就是这个也是非常好的这样的一个应答。大家还有
Great. more questions? Do you think any? Those some good questions though.
Yeah， 感谢大家的问题，就是这些问题都非常的好，然后也可以有很好的讨论。
Okay.
Yeah, I think we are about
Great.
time. Yes.
Wonderful. Okay. And so if any of our trainers do have any other questions that they'd like to ask Elena, then you're welcome to message me through WeChat and I can get an answer for you.
Thank you. 那我们自己培训师就是我们如果大家后续还有其他的问题的话，也可以发在我们的微信的群里面。那我们的Rebecca医生也非常乐意来把我们的问题来转告来请教帮助我们来解答。Thank you so much, Dr. Elena, and thank you, Rebecca, for your time and your sharing.
My pleasure.
It's really.
Thanks for inviting me. Great.
Well,
thank you for inviting me.
Thank you. Thank you so much. I have really enjoyed this whole course. So we have recorded this webinar and we will post it online. And later we will share the link along with your presentation. Thank you so much. Yes.
Okay.
It's wonderful.
So, yes. So I just quickly talk through the next webinar. And then we can stop. 好，那我们接下来下一次的系列的网课是临床兽医与同一健康。那我们今天也非常感谢老师的时间还有他的分享，我们有进行录像，我们后期会上传到优酷，然后会分享链接。那我们下一次的网课是11月7号星期天的下午4点到5点半。那我们就是在微信群里面已经分享了我们的这个海报还有时间，那也希望大家能够继续的关注来参与。那我们接下来就是下一次的这个课程呢，我们是邀请的中山大学陆教授来为兽医师来讲关于同一健康。那作为这个世界同一健康日的这个回应，那我们国家国内外都非常关注这个同一健康的这样的一个主题，我们国家也非常积极的在探讨。那兽医其实是同一健康非常重要的组成部分，还有中间的力量，所以有很多可以探讨和学习的内容，也欢迎大家来预留时间来参与，来一起来探讨。那就是感谢大家 ，Thank you so much, and thank you for everyone joining us.
Thanks, Elena. Very much appreciate it. Thank you so much, everybody. Have a nice evening.
Bye.
Thank you. Bye.